Hello, my name is Crystal Johnston, and I am an LPN to BSN nursing student at Indiana State University, and I will be presenting my health education project for community nursing. The title of this presentation is Bringing Healthcare to the Unhoused, and I will be discussing how lack of accessible healthcare affects a certain population at risk, which is unhoused Americans. The learning objectives for this presentation are that the audience will define homelessness and demonstrate cultural competency in regards to the unhoused. The audience will describe the barriers that the unhoused experience in managing chronic health conditions. The audience will list strategies to make healthcare services accessible to the unhoused. The audience will collaborate with the interdisciplinary team to promote continuity of care. And the audience will list resources to find more information. Before I begin the presentation, I have included a short pretest for you to complete. Please pause this video presentation and click the link below. There is also a link to a handout to use when following along. Homelessness is defined as having no home or permanent place of residence. This includes individuals living on the streets, in encampments, in shelters, and in transitional housing. The National Law Center on Homelessness and Poverty estimates that 2.5 to 3.5 million Americans are currently unhoused, and the number continues to increase. Health issues can lead to unemployment, poverty, and ultimately homelessness, which then exacerbates already poor health. Due to the lack of access to healthcare services, the unhoused end up relying on emergency department for healthcare, which is extremely expensive and ineffective. Homelessness is so hard on the unhoused that the life expectancy is 30 years less than individuals that do not experience homelessness. We tend to treat all homeless as the same, but homelessness is heterogeneous and is caused by a variety of societal factors. Thus, cultural competency is vital in assisting this population. Unhoused individuals each have a unique set of circumstances, and it is important to address personal bias and assumptions regarding the unhoused. There are many barriers to health care for the unhoused. A major barrier is competing priorities of food and safety. It is hard to attend to one's health care when basic needs such as food and safety are not met. These tend to take priority, especially when it comes to chronic conditions. Another major barrier is cost. Many unhoused do not have insurance or money to pay for services, so they end up using the emergency room, which cannot legally turn someone away if they can't pay. Lack of transportation is another huge barrier because healthcare services are not often conveniently located. If public transportation is available, it can be costly to somebody with no income and difficult because the unhoused often need to carry all of their belongings with them. The unhoused often have a difficult time navigating complex healthcare systems due to mental health symptoms. It is difficult to track appointments, meet new providers, and advocate for oneself. Many unhoused Americans live with co-occurring conditions that require complex and lengthy treatment, which is another barrier. Perceived difficulties due to stigma and discrimination is a huge barrier for the unhoused. Many unhoused Americans do not feel comfortable seeking services due to the way healthcare workers treat them. That is why it is important for healthcare workers to understand homelessness and be self-aware of their own biases. If the unhoused are met with supportive and understanding healthcare workers, they are more likely to seek services. So what are some solutions? How do we improve the health and wellness of unhoused Americans? There are some solutions out there. One is federally qualified health centers, which are clinics that serve everyone regardless of ability to pay. This overcomes the barrier of cost. Another solution, which is gaining traction, is one-site clinics that are located in areas with large unhoused populations. These allow for multiple treatment in one location, including medical, dental, and mental health treatment. Some one-site clinics are flexible with appointments and are walk-in. This overcomes some of the issues with managing co-occurring conditions since multiple services can be obtained in one location at once. It makes coordination of care much more successful. It also helps those unhoused individuals with mental health symptoms navigate the system because they only have to go to one place instead of multiple locations and providers. Mobile clinics are seen in some cities in America. They are often in buses and set up free care once or twice a month. Many of them allow patients to be anonymous and have social workers present to get social services on board for those who are willing. These clinics are often volunteer-based and have very limited resources. However, they are very effective at community outreach since they are mobile. These clinics also tend to overcome the barrier of stigma because the healthcare workers are volunteers who have compassion and understanding of vulnerable populations. Street medicine is a form of community outreach where healthcare workers hit the streets and bring healthcare to the unhoused Americans. This approach is extremely limited because healthcare workers are on foot and can only carry so many supplies, so services are limited. Another solution that reduces the difficulties with navigating the system is intensive case management, where the caseworker works in the community assisting unhoused individuals with scheduling and attending appointments, prescription medications, and acting as an advocate to coordinate care. Intensive case management is multifaceted and promotes continuity of care through utilization and organization of the interdisciplinary team. All members of the interdisciplinary team should be trained to identify the needs of the unhoused and take a patient-centered and trauma-informed approach. Case managers are essential members of the team because they coordinate services between the various disciplines. This includes healthcare and social services such as housing and financial support. Mental health providers, including substance abuse treatment, are important members of the interdisciplinary team. Medical providers, including primary care, specialists, and wound care, are all vital in promoting continuity of care. Other interdisciplinary team members include dental and vision providers, physical therapy, nutrition consult, diagnostics, and pharmacies. The successful coordination of these healthcare services can drastically improve the health of unhoused Americans. In conclusion, unhoused Americans have more health disparities than their housed counterparts and have many barriers to accessing healthcare services. Homelessness is a highly individualized experience and requires cultural competency and awareness of personal bias of the healthcare workers. Barriers include competing priorities such as food and safety, cost of services, lack of transportation, mental health symptoms which interfere with navigating complex healthcare systems, co-occurring conditions requiring complex and lengthy treatment, and stigma and discrimination. Solutions to improve access to healthcare services include federally qualified health clinics, one-site clinics, mobile clinics, street medicine, and intensive case management. Coordination of the entire interdisciplinary team is vital for successfully providing healthcare to unhoused Americans. For more information, please visit the National Law Center on Homelessness and Poverty's webpage and the National Healthcare for the Homeless Council's webpage.